Well, you've dug in now, and over the weeks past, hopefully you've been diligent and a curious student of the modern approaches to improvement in complex systems. You've been a student of the generators of population health, very deep sciences there, a student of modern improvement sciences as IHI was founded to advance, and a student now of mobilization and social change and what the leadership tasks are. I hope you've enjoyed it. Over time, you'll become more and more a master of these techniques as you put them to work. I hope you put them to work in the ICANN project and report back to us on what you're learning and how it's going, so we can improve ICANN and improve indeed the education you've just been through. And I hope you'll embrace these ideas and methods as a leader of change from now on through the rest of your career. What have you learned? Well, let's go over a list. You've learned to be a systems thinker. You've learned how influences can be complex, much more complex than you see at first. You've learned to ask the key question, not what do I do, but what am I part of? You've understood organization as a leadership practice, that there are methods in the world that will allow you to be a more effective person, pulling together your own efforts in concert with others to achieve goals that you otherwise might not have been able to achieve. You've understood how to use a motivating vision and a call to action based on meaning in your life and the lives of others, so that you can come up with concerted efforts that make you much more powerful together than you would be separately. You've learned how to identify the people you're going to be working with, identifying stakeholders, build relationships with them, break down misunderstandings, do away with myths, and begin to construct mutual commitments in which you begin to sense that you're all part of the same effort. You've learned how to take stock of the assets around you, about all of the resources you can mobilize as a change agent, and the opportunities, not just in your local setting in healthcare, but in the entire communities that you're trying to mobilize. Becoming aware of the abundance of assets that we can bring to bear on change is key to effective leadership of change. You've created a distributed leadership structure, not trying to get it done all by yourself, but understanding that everyone is a leader, and mobilizing the leader within each of the people, each of the colleagues that you are able to nurture as you meet others and begin to work on mutual commitments. That's where the power really lies. And you're able now to leverage not only your own skills, but those of the people you're working with and the teams that take shape. You've refined your commitment to communication skills in reaching outside of your more comfortable areas, the silos you're used to, and engaging members of the team, the healthcare team and the community team, whom you might not otherwise have met or learned to communicate with. And some of you, I hope, have taken all of that now to begin to take action, real measurable action, action now, to improve the health of populations. Has it always gone perfectly or well? No. Have you probably failed at points, and maybe even feeling a bit in general that it hasn't worked the way you want? Possibly yes. That's what learning is about. To gain these skills, to keep trying, get back on the bike, try again, and get back on the bike again. That's what the leadership of improvement feels like. That's what you're capable of doing. You're not done. These skills are lifelong skills to adopt. I learn every day still about the methods of improvement and mobilization and the subject matter. So will you. But now you're in a position to mobilize your own efforts, the efforts of others that you get to work with now, and meet people you never would have thought you're in the same game with, but you are. And you've learned how to mobilize energy to achieve things that otherwise couldn't be achieved. Congratulations on what you've learned. Congratulations on what you've done. And even more congratulations on what you're going to do. Thanks.